It has been a very long time since the attention has been placed on our field in the way that it is right now. Everyone is looking to our field for leadership.
Welcome to the Mid-America PTTC podcast, where we are a community of change leaders and prevention catalysts that strive to empower individuals and communities to promote safe, healthy, and drug-free communities across our region. We're honored to have you as a member of our PTTC community. Thanks for listening and keep up the great work.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative, and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth, and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 24, and today we'll be talking with Carlton Hall. Carlton is a president and CEO of Carlton Hall Consulting, which is a multifaceted full-service consulting firm designed to provide customized solutions and enable measurable change for communities, organizations, families, and individuals. Carlton previously spent 12 years with the Community Anti-Drug Coalitions of America, or CADCA, where he was serving in several leadership positions, and including, most recently, acting vice president, training operations, and acting director for CADCA's National Coalition Institute. Through his acting director role, he was responsible for the day-to-day operational oversight, design, and implementation of CADCA's premier national training delivery system. Carlton also supported CADCA's international programs in partnership with the U.S. State Department's International Narcotics Law Enforcement Division. There he managed training programs in Kenya, South Africa, and Ghana. Carlton is one of the primary architects of CADCA's National Coalition Academy. The Academy, a year-long coalition development program, is designed to increase the effectiveness of communities in drug demand reduction, producing population-level outcomes. With more than 25 years' experience in the field of government relations, social services, and prevention science, Carlton first gained national prominence as a Communities That Care project manager. He was also appointed the project director for the Communities That Care process in Philadelphia, as well as the crime and public safety manager for the Philadelphia Empowerment Zone, a division of the Mayor's Office of Community Services. During that time, he managed a small planning grant to over $3 million for science-based prevention programming in the neighborhoods of Philadelphia. Carlton was also responsible for the design and implementation of the award-winning Operation Makeover, an effective community-wide intervention addressing blatant open-air drug trafficking and increasing levels of juvenile violence and substance abuse offenses. Operation Makeover was recognized by Vice President Al Gore and featured in Programs That Work, a publication by the Office of Housing and Urban Development. After years of volunteering with many youth organizations, Carlton founded the Strong Foundation in 1993, which created opportunities to reduce service duplication while increasing partnerships with existing youth organizations. Carlton's responsibilities, unique set of skills and experiences has made him one of the most highly sought after instructors and guides for community problem solving in every state and territory in the nation, as well as internationally, with successful achievements in South Africa, Ghana, Bermuda, Kenya, and many others. Before we get into the content, we would like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's start today's episode. All right, and I would like to welcome to the podcast Carlton Hall. Carlton, thanks for joining us.
Thanks for having me.
It is an honor. I've been looking forward to this episode for a long time now. But for those folks in our region that might not be familiar with your background, could you just sort of share a little bit about your background with us, please?
Absolutely. And let me just start off by saying a huge thank you to you and for the work that you're doing and the leadership that you're providing in our field. I think what you're doing is extraordinary, Dave, and really happy to be here. I've had a truly interesting career, and I would frame it this way. I've had 25 years of extraordinary teachers and mentors and collaborators that have actually helped to contribute to the work that I've been able to do in this field. Everyone from academics and pioneers like David Hawkins and Richard Catalano, who provided us with extraordinary correlates of risk factors and protective factors that have become the way in which we look at prevention, working with some of our colleagues like Dr. Kevin Haggerty of University of Washington and Dr. Mark Greenberg, who provided us with promoting alternative thinking strategies as a prevention implementation. Dr. Mark Wolfson, who has done some extraordinary work with underage drinking and contributed to the literature that we've come to utilize. Dr. Vincent Francisco from University of Kansas and the Community Toolbox. All of those have informed my career as well as practitioners and professionals who really helped me to shape how it is that I've been able to apply some of those resources and to understand what's it mean to implement those things. Jane Callahan, Kareem Abdullah come to mind, Dr. Paul Evison, extraordinary trainers such as Dave Chevelle and Teresa Bishop, Amy Ronshausen, Sue Thal from CADCA, Dr. Kevin Sabat, sharing and showing and allowing us to understand what's it mean to influence policymakers. And of course, we've worked quite a bit with each other, both you and Dave Anderson, who created a really wonderful seminal book, Leadership in Drug and Alcohol Prevention, that I highly recommend. And folks like Doctors Bob and Carolyn DuPont and their recent work, Chemical Slavery. All of these individuals over the course of my career, starting off in Philadelphia in the mayor's office, having an opportunity to inform crime and public safety efforts through Philadelphia Empowerment Zone was the first time I was able to touch the Communities That Care framework and see how to apply it in my local communities there in Philadelphia, to working with an extraordinary organization, the Community Anti-Drug Coalitions of America, for more than a dozen years, really contributing to the leadership there and their training and technical assistance delivery system. It's been an extraordinary career informed by a huge host of folks across this nation that have really helped me to understand prevention in the way that we do today.
I love how you included your teachers and mentors and collaborators. That really just points to the spirit and our motto in our region, to build the community, to build the capacity. Because we in prevention as a field are one big community. We're all in this together. We've got to help each other and support each other. I love that. I love that.
I've been so fortunate to be able to glean from all of those different perspectives, and they've really helped to inform the way I think about prevention.
I'm really excited that you'll be coming to our region this year, working on a second time too, so be ready. But the spirit and the message behind the trainings we're working on, we're going to talk about changing the conversation around prevention. When I say that, what comes to mind? What are your thoughts?
Sure, and thank you for the question, because I think it's a point where we really need to get clear. As I have kind of talked about at other times, and we'll speak to here, we are living in some extraordinary times. There is a phrase that Dr. King shared during one of his speeches, where he talks about this fierce urgency of now, and I believe we are living in that kind of a time here as it relates to our field. We have probably the most ambitious and aggressive and admittedly successful movement towards legalization, right now primarily focused on marijuana, but all the indications are kind of a look for broader legalization for broader drugs. All of that is happening at the exact same time as we're having probably the most tragic and impactful overdose crisis our nation has ever seen. That presents us with both this extraordinary challenge, but also this extraordinary opportunity. It has been a very long time since the attention has been placed on our field in the way that it is right now. Everyone is looking to our field for leadership in how to address these dual challenges that has presented such a crisis to our country. And as I go around the country, Dave, and I'm speaking to county leaders, I'm speaking to coalition leaders, I'm speaking to community members, I'm speaking to parents who've lost loved ones, I'm speaking to those who have been impacted by the devastation of this crisis that we are in. I'm struck by how much work there is to do. I'm struck by how unclear most folks outside of the bubble of our field, how confused they are about who we are, about what we do, and about what our role is in helping to ameliorate the issues and the challenges that they are coming to us with. Folks don't understand prevention. They don't know how to define prevention. And it's having a devastating impact on how well we can engage others into the work of change that we are all about. There is no shortage of passionate, caring individuals who want desperately to bring some solution to the problems that they are facing, whether in inner cities across our country that have been devastated by the resurgence of heroin and as fentanyl and carfentanil, or in the rural Appalachian regions of our nation, tribal communities that are seeing unprecedented deaths that have occurred. There's no shortage of folks that want to do something about the challenge that they're facing. And they look to us and they come to us seeking our advice and invitation to participate in some kind of change. But when they come to us and we share with them that the answer is a framework or the answer is some sort of 5-step or 10-step or 7 steps of this or that. When we speak in what I refer to as preventionese to folks that care desperately to bring about change in their communities, I think we're creating a huge and critical gap in engagement. And so that's why I believe that there is a need to change the discourse, to change the conversation that we're having as a country. I think that there are 3 areas that we have to pay attention to. One is that we have to be clearer about who we are and our explanation of who we are and the role that we play towards addressing this challenge. I think, secondly, that there are indeed gaps in the kind of conversations that we're having as a nation. We are not spending nearly enough time talking about things such as the role of friends and family and how that is a major driver of some of the issues and challenges that we have, but it also provides a unique opportunity for those that are in the field of prevention to engage in ways that law enforcement, for example, cannot. I think we are missing the point in the conversation of ethnic or racial disparities or inequities that are really resulting in unprecedented deaths. There's a whole different kind of conversation that many within communities of color are having about the current era that we're in. And we, in the field of prevention, are, I think, woefully prepared to engage in those kind of conversations in meaningful ways, unless we think and are thoughtful about how we change our conversation. And so I've just felt this need to be able to go around the country and to try to provide a spark of a different kind of conversation. Some things that we may talk about a little later, where we can move beyond frameworks and really look at what and how the role of prevention ought to be thought of in terms of this current times that we're in. That's what changing the conversation really means for me.
I like it. I like it. Building and engaging with folks to have conversations that matter, that really drive us to that deeper understanding of the what and the why and the how, so we can really come together to drive that change. But it all starts with changing that conversation and having those conversations that really do matter.
That's exactly right.
Yes. And that just reminded me why you were the first call for our Creating Change, Empowering the Leader Within this last year in Kansas City. Because
it was a fun time.
Yes, it was. Because in prevention, we are all leaders, no matter what level we're at. We're all trying to lead change in our communities or our organizations. So one could say prevention is better together, and together we are stronger.
Without question, without question. And if I could put a bit of a frame around that, I think that if we're talking about engagement, I think there are what I refer to as three spheres of engagement, three engagement spheres that we really need to pay some real attention to. So if you think of a Venn diagram, right, of three circles intersecting with each other, right, I would fill one circle with those whom I refer to as prevention professionals and researchers, right, and a second circle with the political and resource, those who have the levers to really bring about change from a political and a resource effort. And that third circle then being the broader population base, right? The challenge is that each one of those circles kind of thinks about prevention in their own way, talks about prevention in their own way, and has kind of their own language and understanding of prevention. And there is a real need for us to be able to look at how we might be able to come and be clearer about what prevention is, and how we might be able to engage folks more intentionally and strategically to be able to create change.
Yes, building that team, absolutely, to drive change.
Yeah.
So when it comes to the conversation around prevention, in those three different engagement spheres, what do you see as far as sort of clarity regarding what prevention is, or clarity of prevention, or how it works?
Sure thing. And I would suggest that there part of what it is that we're suffering from is a real lack of clarity around prevention. Prevention means a lot of different things to a lot of different folks are utilizing the term to kind of almost represent almost anything, right, these days. And it is somewhat diluting kind of the message that we're really wanting to convey. I would say that there is a need to understand the distinction between prevention versus, say, prevention science. Right, and the way I think about it is prevention is an action. Prevention is a verb, right? Prevention is about what is that you do to apply the science and the tools and the resource and the knowledge and the information that we get from prevention science. Prevention science represents those tools and that research and the strategies and concepts that we would implement. The various frameworks that we would consider to address how to help folks really engage in bringing about population level change is all represented by the science of prevention. But prevention itself is really about how we take that science and apply it practically to bring about changes in our society. And whether or not we are looking at how those actions and strategies are categorized by the National Academy of Science and Medicine, formerly the Institute of Medicine's kind of universal selected and indicated kind of categorization of those strategies, it's really about the doing. And in that same regard, what I thought about, and kind of what it is that I have kind of made my mission, is how we help our field master prevention as a craft. I suggest to everyone that prevention is more than a science, it's a craft. There's a craftsmanship to prevention that I believe that we all are working to kind of build upon in order to gain some mastery of that craft. I think that's the journey that we are all on, and it is founded on what I refer to as these three core beliefs that kind of guide our work towards mastering the craft of prevention. Belief number one is we believe fully that in order to address any problem or solve any problem, it's best to stop that problem before it occurs. That's a core belief of us as preventionists. The second thing we believe is the full engagement and empowerment of the broader community in both understanding the problem and addressing that problem, be a part of the solution towards that problem. And the third core belief is that we believe that all of these actions ought to be guided by science, by empirical science that helps to bring about change at a population level. Those three core beliefs are what I believe really should be guiding our thinking, our work, as we're trying to apply it to the science of prevention. Does that make sense, Dave?
Yes, you can almost use those core beliefs as I'll call it a compass to make sure you're staying the course. Are we working within those beliefs, working towards those?
Exactly right. I mean, you and I were having a conversation. I believe we are both somewhat fans of Simon Sinek's kind of work, starting with Why and his golden circle, if you will, of understanding the what and the how, but really bearing down on the why of it, and the whole notion that underscores his seminal work is really about the fact that you have to really understand your why if you're going to be able to engage others in what is it that you are ultimately believing in. What I have observed is that we in prevention are really good at expressing our what's and our hows, right? We are able to tell folks the 5 phases of this, and we got the 7 strategies for that, and we have frameworks upon frameworks upon frameworks that we can refer to and repeat and regurgitate when folks ask us about what is it that we do. But we have a hard time getting folks to understand and buy into our why. And for me, those 3 core beliefs are the why of our prevention work.
Absolutely. And fun little side note, I'm currently reading Simon's latest book, The Infinite Game, and all I can think about is the prevention field.
Without question. I've read it myself. It's a great book.
Okay. So sort of staying back on track, talking about, prevention, being a craft, could you kind of identify some core areas or focus areas of craftsmanship?
Yeah. So if you think about any discipline that we would assign craftsmanship to, right? There's a certain set of skills that are understood. What makes this a craft is that there are specific skills that can be measured, observed, demonstrated, so that we know when someone is a masterful golfer versus someone who is clearly just swinging a club, right? And so there are certain skills that everyone has an understanding of, that there's agreement upon, and the like. I would suggest that the same holds true for those that are attempting to use those three core guiding beliefs to bring about population level change in prevention. And I've kind of assigned those skills, and there's any number of skills that can be enumerated, but I've kind of framed them in three kind of areas that represent the craftsmanship of prevention. The first area is a need to really clarify our story, right? Here's where we're looking at understanding assessment and data, and looking at the readiness of our community to bring about change. It's where we look at creating a picture of the kind of model for change that we want to bring about, the development of a logic model as an example of that, looking at how we measure our efforts and are able to determine how effective we are in creating that change, and our ability to document evidence of that effect and convey kind of our impact upon the change. How we tell our story, defining the problem, measuring the challenge, looking at where and how we are impacting that challenge is kind of that first area of craftsmanship. The second area of craftsmanship I would share is defining our leverage, right? Once we have clarified our story, we ought to be able to define how we're going to make that difference. What are the strategies that we're going to bring to bear? What's the strategic and action plan that we are utilizing? How are we able to crystallize in our local context and condition, what are the areas that we can have the greatest impact upon, and how we would execute that impact. So area number one for craftsmanship is clarifying our story. Area number two is defining our leverage. And that brings me to area number three, which I define as direct action and mass engagement. This is where we employ all the various sectors of our community to be a part of not only understanding that problem, but seeing their role in solving that problem. What is the role of law enforcement? What is the role of our faith community? What is the role of our youth and our educators? What is the role of our health sector? How do each of those play a role in reaching out to their various constituencies to bring about massive direct action upon the change areas that we are trying to affect? So yes, it is in building a coalition, but it really is building the capacity of that coalition, moving beyond those 7 to 12 individuals and really seeing how can we galvanize and engage the broader community into this change effort that we are trying to employ. And so with each of those areas of craftsmanship, there are certain sets of skills, tools, resources that can be brought to bear, which really has become kind of the mission of the work that I have been doing through my consultancy and the work that I do in collaboration with others, such as the PTTCs. to really help those that are in this prevention field understand those three areas.
Marvelous. Second time brought up clarity. Earlier we're talking about lack of clarity regarding prevention, but then also clarifying our story.
Yes.
Clarity is kindness. It really is. You've got to figure it out. I like to, defining our leverage. For me, and I kind of call it really making sure we're working in our strengths.
Yeah.
So coming into this role, the PTTC, I really did a good deep reflection. What are my strengths that I can bring to the table for the benefit of the field, for the benefit of the region and the TTC network, and just making sure I'm working in those strengths. And I identified those strengths from clarifying my story. Yes. Absolutely. I like it.
So what you were able to just apply in a very individualized, personal way, I suggest those in our field, and that our field as a whole has to begin to do. What I hear very often is I hear folks defining prevention as a framework. So, for example, the strategic prevention framework is a set of guiding kind of principles with tools that are associated with those principles that really help to clarify for those of us in prevention how to engage the community and bring about change at the population level. We get that. But the strategic prevention framework is a tool, right? It is not synonymous with prevention. It is a tool for the preventionists to be able to use. Does that make sense? And what I hope folks get is that there are a host of tools that they should be availing themselves of, become more strategic in their employment if they're going to move from dabbling in prevention to mastering this craft that we refer to as prevention.
Yes. And I always like to just remind folks, when it comes to learning and crafting and mastering these skills, that you've identified, we can look outside of our traditional prevention focus. There is some great content out there. I actually was just reading Seth Godin's This is Marketing and thinking about how we can apply that to prevention. In fact, one of the big takeaways I had there is he talks about, many marketers will say culture is one of their marketing strategies. And he says, no, culture isn't a strategy. It is the strategy.
Exactly.
Environmental prevention strategies. What are those? Trying to influence the culture and context in which individuals make decisions around substance use. Culture. It's important. But yes, there's so much we can learn from outside the prevention scope as far as what we typically read and where we look. And I know you're very good at doing that. That's why we drive so well.
Thank you for that. And just as you shared in terms of Seth Godin's kind of work, one of the beautiful things about the time that we're in is that we've never known more about prevention than we do right now, right? We've never had as much information as we have right now. The field of prevention, the science of prevention has continued to evolve. And so we're constantly learning more and improving upon those models of change over time. I've talked about the 25-year arc of my own career. I share with you that there are some important ideas and concepts that are just beginning to become diffused throughout our field. Sloboda, Dr. Sloboda, who's done some remarkable work in helping to craft something that's referred to as the Universal Prevention Curriculum, has really identified some ideas that have become even more clarifying, moving from a risk factor and protective factor kind of only paradigm that many of us in prevention know very well, to looking at where and how vulnerability, for example, plays a role in how young people become exposed to some of the challenges towards some of the behaviors that we're trying to address, and how we can utilize that vulnerability paradigm to really engage folks. It's about digging deeper. Dr. DuPont, for example, has really helped to advance the notion that we have to get beyond this, what I refer to as whack-a-mole kind of approach towards our efforts. Now the whole conversation is around fentanyl and carfentanil, where before it was around the misuse of prescription opioids. We go from marijuana to an emerging challenge that we're having with psychostimulants that are kind of re-emerging now. We consistently are chasing after kind of what is the major issue or challenge of the day, whether it's vaping and the issues around vaping that has become so much in the news of late, to really helping us to understand that a real rethinking and reframing of that is thinking about the challenge that we're really in is one of commercialized recreational polydrug use, right? And it's not about any singular substance. It's about the fact that there is hardly anyone who is going through the throes of addiction who have focused exclusively on one substance. There's always drug use involved. But that means something to how we apply our understanding about how we can really work towards prevention and preventing of those issues and those challenges. So I guess what I'm trying to say in a nutshell is that we've learned a whole heck of a lot over the last 25 years in this field. We've made some extraordinary strides and have achieved some remarkable successes in our field. But if we're going to really affect change in a way that this fierce, urgent time is calling for, we have to begin to change some of the conversations that we're having and look more deeply at prevention, not merely as a science, but as a craft, and that there are indeed elements and aspects of this craft that we can all improve upon. And part of what it is that we've been trying to do across the nation is to help folks with just that.
Fired up. That's where I'm at right now.
I'm right with you, brother. I'm right with you.
Well, I'll tell you what, this has just been marvelous. And I'm thinking we need to have you back on for another episode down the road. So start checking your calendar.
Absolutely. We've only scratched the surface, my friend. Thank you so much for the opportunity.
Hey, thank you very much for taking time. I know you're always on the road because you are driven to serve others. So thank you very much. It's been an honor. And stay tuned, folks, for the next episode.